Hello and welcome to my channel. In this lecture we'll be discussing the vessels and nerves of the flexor compartment of the legs, so let's begin. Of course, the artery of the flexor compartment is the posterior tibial artery. It's a branch of the popliteal artery. This is the posterior tibial artery. Branch of the popliteal artery at the lower end, the lower border of popliteus. And it descends rather medially on the tibialis posterior muscle and the flexor digitorum longus muscles, deep to soleus and gastrocnemius, of course. The pulse of the posterior tibial artery can only be felt lower down behind the border of the when it passes deep to the flexor retinaculum and the abductor hallucis behind the medial border of the tibia. It divides into medial and lateral plantar arteries, terminal branches. The branches of the posterior tibial artery, first branch is the circumflex fibular, a branch that goes around the upper end of fibula, around the neck of fibula, and shares in the anastomosis around the knee, as you remember. Peroneal artery that descends along the medial crest of the fibula, distal to popliteus and between tibialis posterior and flexor hallucis longus. The peroneal artery gives nutrient to fibula, of course, muscular branches, a communicating branch lower down with the posterior tibial artery, proximal to the ankle, calcaneal branches, and perforating branch. It perforates the interosseous membrane and ends, but sometimes it perforates and replaces the dorsalis pedis artery. Sometimes it replaces the dorsalis pedis artery. This will be the end of the peroneal artery. Other branches of the posterior tibial artery, nutrient to tibia, muscular branches, of course, medial malleolar, and calcaneal, also calcaneal branches of posterior tibial. The medial plantar artery, the medial and lateral plantars originate covered by the abductor hallucis muscle. The medial plantar gives muscular branches, digital branches, and ends at the medial side of the hallux, the big toe. The lateral plantar artery, larger than the medial plantar, and forms the plantar arch. See? Forms the plantar arch. With the deep branch of the lateral plantar nerve in the concavity of the arch. The arch gives metatarsal and digital branches, and the perforating branches between, remember the ones we talked about when discussing the dorsal metatarsals. There are perforating branches, proximal perforating branches, and distal perforating branches between the plantar metatarsals and the dorsal metatarsals. It ends as the lateral digital branch of the fifth toe, as you can see here. Okay, the posterior tibial artery is accompanied by venae comitatus that, together with the comitatus of the anterior tibial artery, will form the popliteal vein. Okay. Now, superficial veins of the lower limb, the great Softness vein, of course. From the dorsal venous arch that formed from the digital branches and metatarsal branches, will give medial marginal vein and lateral marginal veins. The medial marginal vein will pass anterior to the medial malleolus to form the great Softness vein. Now, the great Softness vein will ascend along the border of the tibia and hand breadth behind the patella of the knee, ascends on the thigh and opens into the passes through the saphenous opening and drains into the femoral vein. It's accompanied by the medial femoral cutaneous nerve. Tributaries of the great saphenous vein. There is a communicating tributary with small saphenous. There are perforators with the deep, its connection with the deep system. I mean, the venae comitantes of the deep arteries, of the posterior and anterior tibial arteries. One above the ankle, one below the knee, one above the knee, and in the mid-thigh, maybe one with the femoral. And these represent a communication between the superficial venous system of the lower limb and the deep venous system of the lower limb. It also receives the anterolateral and posteromedial venous columns once they are formed on the thigh, and receives also the branches or tributaries corresponding to the superficial branches of femoral artery, like the superficial epigastric, the superficial circumflex iliac, superficial and deep external pudendals. Okay? This is the great saphenous vein. The small or short saphenous vein, it's a continuation of the lateral marginal vein, but the lateral marginal behind the lateral malleolus, please pay attention to this. It differs from the medial side. Ascends on the fascia of the gastrocnemius, accompanied by the sural nerve, and drain into the popliteal vein. Okay? Lymphatics of the leg and foot go first to the popliteal lymph nodes, the ones we talked about, and then from them to the superficial inguinal lymph nodes, the inferior group of superficial inguinal lymph nodes. Now, the tibial nerve, branch of sciatic nerve, gives branches, muscular branches, of course. The sural nerve in the popliteal fossa descends with the small saphenous vein. The sural nerve will end by supplying the lateral side of the little toe and gives medial calcaneal branches to the heel and medial side of foot. The medial plantar nerve appears between the adductor hallucis and flexor digitorum brevis, lateral to artery, and supplies adductor hallucis, the flexor hallucis brevis, the flexor digitorum brevis, and first lumbrical muscle. Supplies the skin of sole on the medial side, of course, and the tarsal and metatarsal joints. The lateral plantar nerve between flexor digitorum brevis and quadratus plantae and flexor digitorum brevis supplies both, and then between flexor digitorum brevis and abductor digiti minimi on the lateral side of foot, and supplies both, then divides into superficial branch, the one you see here, and the deep branch. The deep branch is in the concavity of the plantar arch, supplies the rest of the muscles. Superficial branch supplies the flexor digitorum, flexor digiti minimi, the fourth space interossei, the skin of the lateral side of the little toe, sharing it with the sural nerve, of course, the fourth cleft and sides of adjacent toes, and lateral part of sole skin. The deep branch with the plantar arch, as mentioned earlier. The dermatomes of the lower limb, as you can see here, the dorsum of foot is with L5 that extends to the leg and to the thigh till the gluteal region. The lateral side of foot by S1, the calcaneus, the heel, by L5, the medial side of foot by L4, and the medial side of the heel here by S2. Still, the L5 is on the dorsum of foot. L5 is also, occupies the middle of the sole of foot. S1 on the lateral side, L4 on the medial side. The reflexes, the knee jerk and the ankle jerk, The segment for the knee jerk is L3, and segment for the ankle jerk is the S1. Okay, this concludes our talk about the vessels and nerves of the posterior compartment or the flexor compartment. I hope you got the maximum benefit from this lecture, and thank you very much for watching.